introduction at this point, and then we have 5 speakers, and initially I'd like to welcome State Senator Saud Anwar and Representative Kristen McCarthy-Vahey. They would like to speak jointly, and as they're coming up, I would just briefly introduce them. So Senator Saud Anwar, MD, MPH, he's a state senator and represents Connecticut 3rd District and is a physician specializing in pulmonary and critical care medicine. He serves as the chair of the Department of Internal Medicine at Manchester Memorial and Rockville General Hospital and holds a Master's of Public Health from Yale University. Dr. Anwar is deeply committed to advancing public health and community health initiatives across Connecticut. Representative Kristen McCarthy-Vahey is state representative and serves Fairfield's 133rd Assembly District and is House Chair of the Public Health Committee, as well as a member of the Appropriations and Transportation Committees. Since her election in 2005, she has focused on building healthy, safe communities, supporting economic development, improved voter access, and advancing mental health initiatives. She's also a long-term chair of Fairfield Cares Community Coalition and a certified QPR suicide prevention trainer. Welcome and thank you for taking the time.
Thank you. Good afternoon, everyone. So what we'll do is I'll speak a little bit and Representative Kristen McCarthy-Vahey will speak, and then we will present the citation to our colleagues and our friends here. It's such a blessing to be in the presence of this room because we were having discussions from a policy perspective to come to a point where we start these discussions about what we can do to raise the awareness about liver health. And it was because of the efforts of Dr. Wajat Mehel, Dr. Benini, and so many more clinicians from across the state, but also other stakeholders who came together. And it was fascinating to be part of these conversations that this working group looked at to see what we can do as a state to help with the health of our citizens. Liver disease is on the rise, and it's something that unfortunately is not recognized from a public health lens to the level that it should be. So I know many of the people over here are liver specialists, but I also know there are a number of individuals who are internal medicine and they do not necessarily work on liver disease all the time. So I'm just going to share how I would simply try to understand the liver in a simplistic fashion. So for the hepatologist, you can close your ears. You may not like what I'm going to say, but so if we were to look at the entire human body as one family, liver is a member of the family who has a lot of wisdom and kindness and care. This is one of that family members who actually is quiet and quietly ignores some of the bad things that are happening and tries to fix them on its own and continues to do so as long as it can. It sort of holds on to the abuse, if you will, from the owner of that body, whether it is in the excess of food or the types of food or other substances, and quietly cleans things and without complaining. You never hear about the liver saying anything unless one of the parts of the liver, the gallbladder, which is for the surgeons more so, and we'll leave it aside because that's a different story. But the liver itself is with a lot of gentleness. But at the same time, when this organ gets to a certain point, when it has sustained all the pain and the difficulties that are heading its way, when it reaches a point, then it becomes the first domino to fall. And then suddenly, you realize why it's called the liver, because you live because of it and you cannot live without it. And the dominoes that fall are just fascinating, and the physiology is just amazing because you can have perfect lungs, and when your liver fails, the lungs stop working. You can't exchange oxygen. You have perfect kidneys, but the liver stops working, the kidneys stop functioning. But the kidneys are normal, but they don't stop to function. You can actually give that kidney to somebody else and it would function, but because the liver is not there, the kidney says, I'm not working with you anymore. And then the heart and the brain is fascinating because you get confused. And then you have this fascinating pattern. So that's where it comes in. So one of the ideas and the thoughts we had was that we need to celebrate this kind, wise organ and have a prevention strategy to be the support from a public health lens of this special organ. And also have a system in place so that we can have screening processes that we would start. And then identify it early and then make sure that our elders are protected and this organ is protected. Because the health of this organ is critical to the well-being of our society. And right now, corporations and others have resulted in harm to it. And that harm is impacting a large community. If you look at the fatty liver disease or MASLD, this is not going to be healthy if we do not have interventions. And we have to, when you start to see people in their 30s who have not touched alcohol and their livers are not functioning well, that should be a panic button. But that panic button is not being pressed anywhere in most part of our country. But we in Connecticut, thanks to the people in this room, thanks to Dr. Wajahat Mahal, Dr. Benini, and others, we have, as a state, said we are pressing this panic button and we need to get together to start to find ways to be able to do this. This is not a one-stop. We are going to continue the work that needs to be done. This is so critical, but recognizing this day, getting the people together, starting this conversation is very, very critical. We wouldn't be able to do this as the Public Health Committee, but the state of Connecticut, if the two chairs were not 100% on board, and I cannot do the work that I do without the wisdom and the partnership of my colleague, Representative Kristen McCarthy-Vehy, and I would want her to be the next to speak about this further.